Welcome to Small Town Times. It's Bell Let's Talk Day, so we've decided to have a guest from the Canadian Mental Health Association of North Bay District. Mary Montgomery is the Chief Operating Officer. Thank you for coming. We also have Dave Mendicino, a former councilor, City of North Bay, who's involved with community services and involved with some of the programs that are in North Bay to help with the homeless and addictions and other things like that. So welcome to the studio.
Thanks for having me.
New member of the team with the CMHC. What is your experience? Where are you coming from?
So my background, I'm a social worker, so I have a master's in social work. Wrote my thesis on addictions, women's addiction specifically, and worked in violence against women as it relates to substance use often for many years in Ottawa, and moved back to North Bay in 2014, worked at Community Counseling Center as a manager of addictions there, and have been with CMHA for 6 months.
Oh, wow. Mm-hmm. So broad experience right on. Mm-hmm. What are your first projects? What are you tackling right off the bat?
Right off the bat is program reviews. So ensuring that we have good pathways, that we're meeting the needs of the community in an efficient way, effective way, and really putting a push on data, making sure we have the data to support the work that we're doing.
Oh, okay.
Because as social workers, community mental health workers, that is usually not the first priority, is the numbers, right? It's about providing the service. Mm-hmm. But we need the numbers in order to get the funding.
Any indication about the numbers that can put it into perspective, North Bay's experience right now with addictions and homelessness?
Yeah, so we served over 2,000 people last year in our different programs. There's an increase in overdoses. We have an overdose epidemic that's happening in our community. We're the 5th highest in the province for overdose rates in North Bay. And it's just...
What is our rate? Like what numbers are you talking about?
Yeah, so the provincial average for opioid-related deaths per 100,000 in 2022 was 17.6. In the north, it's 60.1. In North Bay, 53.2 per 100,000 people in 2022.
Wow.
Yeah, in December there were, I believe, 6 or 8 deaths related to opioids in December.
1 month alone.
Yeah.
Would that be one of the highest months because of the holiday? Is there any impact with December and Christmas and that kind of thing?
You know, I think addictions is a complicated thing, and certainly times that have high emotions, whether they're good emotions or whether they're difficult emotions because of, family dynamics, there's always an impact by what's happening in people's lives. So definitely around holidays, people are using more, they're drinking more, whether they're isolated or whether they're with their families.
Yeah, well, I hate Christmas for a lot of those reasons. Right. People's expectations are so high, and then they very much disappointed. You have financial pressures, and it's for a lot of people triggers things. It's I don't know. It's a project for a lot of people to get through, and I was delivering my magazine and talking to a lot of people during the time. Just after the holidays, everybody was so happy it was over.
Isn't that something?
Yeah, they were just very happy. Yeah, and it was just like they survived the holidays again, right? And some of them were just decided not to, really tone down things this year.
I heard that from a lot of people too. People that have the privilege to be with families and buy gifts. We're really cutting down. So even people that had the means to do that were cutting back. So that's what I heard as well.
Any statistics on suicide here?
I don't have the suicide stats. No, we don't have a suicide prevention program at CMHA North Bay, so I did not bring those. No. But we know in the north it's higher. We know that Any place that Indigenous people, it's higher. We have a high Indigenous population in our community. So I don't have the exact stats, but one person, one loss of a life from suicide is too many.
Does that go hand in hand with addictions?
It can. It can. Mental health, for sure. Depression, isolation, sense of hopelessness, all connected to substance use for sure, but doesn't have to be directly related to addiction.
Dave, you've been involved with community services and municipal projects and programs. What's on your mind right now in January as we hit Bell Let's Talk Day?
Well, I mean, during the last term of council, I mean, the mental health and addiction issue really hit us between the eyes, you know, as councilors and as the former Mayor McDonald, you know, sitting around the table, you know, what do we do? I mean, I think the mayor did a great thing during the last term in setting up a mental health and addiction roundtable, getting all the professionals at the table. There was some recommendations that came out of there. One being creating more transitional supportive housing units, and these are services that if you've decided that you want to deal with your mental health and addictions, or you want to get off the street, you don't want to be homeless anymore. There's a bed there that you can utilize until you get the help that you need, that you're able to transition back into the community. There's wraparound services there. I'm proud of the fact that through the city and through DSAB, we created Northern Pines, 61 beds, transitional supportive housing beds that are being used today. The hospital has transferred their mental health and addiction services out of that facility now. So there's individuals in there that have made the decision to transition back into we'll say a normal life, and they're getting the help they need to do that. I've come to learn that how do you deal with these individuals? You deal with them one at a time. When they've made the decision that they want the help today, I mean, along with all the other services that are available in the city, there's a bed there that you can utilize until you're ready to transition back.
I was watching a podcast. It was about how Finland dealt with its homelessness and addictions, and it was a housing first concept, but really supported with constant support. But first, they did the thing they did is they got them off the street into a stable sort of situation, nothing fancy, but it was something it was like an hour and a half long podcast, and they really went right into it, and it looked like it was working for them.
Well, this is you know, we're kind of on the right track. I mean, there's so many challenges. I mean, when I hear we're fifth in overdose, like that just breaks my heart. I mean, there's so much work that's being done, and sometimes we don't feel like we're making the progress that we need to be making. But through Northern Pines, you know, that's a big step in the right direction. With the city purchasing, or they've got a conditional offer on the building next to the gathering place. To me, if that ends up going through, that purchase, all of a sudden you've got the gathering place there now. They're providing the services to feed these individuals. If you're able to secure the building beside it, bring them all in under one umbrella, and I hate this scrambling every year to get a warming center up and running before it starts getting really cold. If the city, I think the city did a very good thing in having their eye on that building right beside the gathering place. If they're able to secure it, and they're able to create a permanent warming center. You wouldn't need it as a permanent warming center in terms of 12 months of the year, but certainly in the months that you do need it, it's there. The rest of the months, it's there for like a drop-in. And if the agencies around, even the police, were able to, the concept was you pick someone up off the street, bring them there. And when you bring them there, there's services there. There's professionals there that are interacting with these individuals. And what I've come to learn is the interaction, the daily interaction, are where you start getting your successes because they start trusting you. Mm-hmm. And these workers, they're trained in case management. Mm-hmm. The concept would be to take them from there eventually to Northern Pines. So you've got a continuum there where you're missing that gap in the middle right now. Where do you take them? Where do they go? They haven't made. They don't want to go to Northern Pines yet. They haven't made that decision. But if they're able to go to a place every day that's available and the meals are there, everything is under one umbrella, I think that would be a pretty good step in the right direction. And I applaud the city for taking that step because they're not in the mental health and addiction business, but through their community safety and well-being plan, they're committed to implementing that plan. And this council is, just like last council was. And I think that's very important.
I agree. I fully agree with Dave that it's all about relationship. So if you have somebody coming in every day, seeing the same people, same faces, they're safe people, they're providing basic needs, they're going to build the trust that they need to go to the next level, right? Because somebody's been homeless for a long time. They've lost trust in themselves. They've lost trust in the system. They probably had negative experiences in the community from other community members, sometimes I've heard stories from service providers. So it's really about building relationship and connection. And it's all about the connection.
Lisa Boyvan, a host of our To North Bay with Love podcast, was at Gathering Place interviewing Dennis Chippa this week. Her show will be out before this one airs. And actually, I think it's going to be tomorrow, Thursday morning. And he had given her a very good, complete picture of how important it is to have those connections so that they feel comfortable to talk, and he doesn't ask questions. There's no judgment there, and it helps both people that are on the verge of homelessness, as well as those that are already there and trying to get out of the ditch.
I really think everybody could use a little bit more unconditional regard in their life, right?
Right.
Full support and acceptance from the people around them, and especially if they've had a lot of negative experiences. And we know that trauma is a part of, I would say, most of those folks' lives. In my experience, the women I've worked with in addictions, in mental health, all of their lives at some point. So trauma-informed care, connection, building relationship, attachment, really. Having a healthy attachment for the first time in many years, possibly.
Now, Dave, I remember you were helpful in getting a program started where there were some outreach workers working downtown to work with them, and I think it was funded through your program for about 4 years. How did that work out, and what's the status of that now?
So is that the HCAP program, Dave?
Yes.
So, yeah.
Healthy Community Ambassador Program.
Yeah,
Oh,
that was a great program, really good program. Made a big difference in people's lives and reduced the number of people who were arrested because they could intervene. Of course, if there was violence or something, they wouldn't intervene in that. But often what happens if the police show up and there's nobody there to provide support, the situation escalates, right? So people will then end up being...
Those are those scary news stories we see where people end up tased and shot, right? Sometimes.
Absolutely. Yeah. So it was very successful. The funding actually, we had two people. So one was funded by the DSAB, and I wasn't there, so correct me if you recall a different history, but I believe there was one position was funded, and we funded the second one. And they would go out in the community and meet people on the street, meet them where they're at, go into the encampments, provide basic supplies, water, food, clothing, hygiene supplies. At one point, they were bringing them in, allowing them to have showers because there was no place for them to have showers. What we found is that we were duplicating service. So there were other organizations in the community that were doing the same work, minus the showers. And we had waitlist growing in our case management portfolio. So we really needed to bring those folks back in and put them back as case managers.
So there wasn't direct funding. It was probably funded through some other means if you had to put those resources somewhere. Is that correct?
Well, there's no. Correct me if I'm wrong. There was no direct funding, so you were funding it from other areas in your budget. Your core services, the demand for your core services, started going up.
Correct.
And it became a budgetary issue. You have to focus on your core services and what you're being funded for. Is that correct?
That's right.
Yeah.
That's
So
right.
what's going on now?
Well, so the Healthy Community Ambassador Program is something that you mentioned that I was involved in it initially, and I was. Quite frankly, it's I was involved in a number of things during the last term of council. This was one of the ones that was for me the most satisfying for two reasons. One is so just before the 2018 election, my brother who lives in Guelph made me aware of this program. They had it in Guelph, Healthy Community Ambassador Program, mental health and addiction workers trained in case management, boots to the ground in the downtown. It was a partnership with the Guelph Police.
Oh, okay, yeah.
So when I went to check it out, I actually saw these workers. They were hand in hand with the police in the downtown, sometimes in the cruisers, sometimes not. And it was working. They'd been into it 1 year, and the results they were getting were fantastic. So when I got elected in 2018, October, it took me a few months, but I started going. This was before CMHA had amalgamated with three other agencies. So I started going to each of those agencies. And I kept on hearing, it's a great program. We'd like to help you out, but we got no money. My last stop was with Mary Davis. So when I said there was two reasons why it was great for me. Was I met Mary Davis is my life partner now. We met, and good things happened from that. But she stepped up and she started funding this program because they saw the benefit of it. So you had, for 4 years, you had trained mental health and addiction workers in the downtown, boots to the ground, specializing in case management services. And then last term, the police chief came to council and with a program saying if we were able to fund 4 additional officers, they would be concentrated on mental health and addiction calls.
Yeah, I think I remember that.
I don't know what the percentage is these days, but a pretty significant percentage of calls that the police get are mental health and addiction calls. Mm-hmm. And the commitment was to concentrate them in the downtown, but from time to time they'd be pulled away. It was great for me because I started seeing this concept that I saw come together. You had CMHA at the table. You had the police now on the table. So once that happened, the DIA made a pitch to try and get both those agencies have those workers with a storefront in the downtown. That was the last step. Unfortunately, we weren't able to achieve that last step. The police, for whatever reason at the time, didn't feel that they could do it. And as time went on, the demand for their services gets pulled elsewhere. They're still in the downtown. They're still a presence. I understand crime statistics have gone down. But the city last year, because the demand was getting so great, they upped their, they started a pilot project with the security company that they have, providing security and outreach workers.
I think I saw
in the downtown.
a couple of them walking around. Yeah.
Yeah. So when Mary says they started duplicating services, once that happened, CMHA obviously needed to pull away for their own reasons.
So both the police and the CMHC really didn't have specifically dedicated personnel for it. So there's an ebb and flow there. And now we have the security outfit doing it.
Well, you have so the security firm that the city hires, they have a contract with them, so they're providing security and outreach workers. But in my mind, what I saw initially was trained mental health and addiction workers, CMHA workers, specializing in case management services, and the police. The police provided the security. CMHA provided the outreach, and it worked. And we were so close. I remember thinking we were so close last term of getting the concept fully operational here. But for various reasons over the last year, that hasn't happened.
Okay, so we still have the same sort of concept happening, but not at the maybe a level below of the training that the police and a worker from CMHC might have.
Yeah, so credit the city again for doing a pilot project, providing funds.
Yeah. Okay.
Because there is a definite need in the downtown, and they'll probably be discussing that pilot project during the upcoming budget discussions.
Okay.
So credit to them for
Filling the gap a little bit.
filling the gap.
Yeah.
But I can't get away from what I initially saw in Guelph that worked
Is Guelph
extremely
still
well.
doing it?
Yes, I believe so. And that was the police and trained mental health and addiction workers.
Yeah, security is going out with peer support workers, so people with lived experience.
Oh, okay.
Which there is some research that says that that's a good fit.
Yeah. Yeah.
And has been successful from what I've heard. Not the vision that you had originally hoped for, but it's happening and it's moving along. So
Okay.
it's True Self that's putting that, and they do really good work at True Self.
Oh, okay. True Self.
I'd still like to see a storefront where the police and the mental health and addiction professionals are working out of to create another layer of presence, right? You've got an actual storefront there. So again, that's a decision for council and the police board, but we'll see.
When you were talking about, I'm just going to go off on a bit of a tangent here. The statistics about overdosing. From my understanding, there's a percentage of the overdoses that are what I would call accidental. Young people experimenting and not realizing the drugs that they're experimenting with are tainted with the fentanyl, which is a lot of times what happens, I think. Do you know what that percentage might be in North Bay area, or like how much is it accidental and how much is it chronic addiction?
Yeah, I can't really speak to that. I think that even somebody who's been using for a long time, or short or long time, doesn't know the potency of the substance they're getting.
Right.
Or they may have been taken off the street for a while. Maybe they've gone to jail. Maybe they've been
I've heard this
in
too.
rehab.
Okay. Yep.
And that's the highest risk time for somebody who's using, because they'll go back and use the same amount.
They don't have the same tolerance.
Correct.
Right. So
Correct.
it's almost even a chronically addicted person can have an accidental overdose.
Absolutely.
Yeah. It's a complicated mess there, right? It was a lot easier when we just had pot and beer.
It's certainly gotten more complicated. Oh, absolutely. The drugs now are so strong, so damaging to people's wellness. It's beyond anything I've ever seen in 30 years I've been doing the work.
And it's a different type of addictions with these chemicals that we, limited the research that I've done with what I do. It rewires the brain a little bit different. It's a lot harder to get off. And there's physical aspects that it's not It's not the old days addictions to heroin or something like that.
Yeah, it's similar to heroin in that it has the physiological. So it's biopsychosocial, right? So you have all addiction is. So you have the physical addiction, and then you have the social piece where people are ostracized. They're shunned, really, for using these types of drugs. And then they become isolated. And then there's the piece around just having nowhere to go and not feeling hopeless. And then what people have to do to get more drugs erodes their self-esteem as well. So I don't know. I've never worked with anybody who said, I wanted to rob people. I wanted to break into people's houses when I grew up. When I was a little boy, that's what I thought of. Or I've never heard a woman say, oh yeah, when I was 5, I couldn't wait to be out on the street corner. You know, things like that. So we really need as a society to begin to understand the level of desperation that can occur in people's lives. And I think there's a whole continuum of services that can be put in place. And there's a whole continuum of people who use substances, right? We know you talked about pot, right? And lots of people smoke pot, lots of people drink beers. No issues with that, right? It's socially acceptable to do those things. It's when it's like there's this hierarchy of drugs, the good drugs, bad drugs. And really, if we could get away from that thinking, we would be, I think, a much kinder, gentler society.
Now, I remember, so 07, I had a hip replacement where I ended up, it didn't heal right. And I was on oxycondines for almost a couple years.
Yeah.
And then went through a divorce and kind of thing. In my line of work, I couldn't reach out.
No.
Has things changed? Because it didn't seem like because I was a public face in person, couldn't write about it, couldn't talk about it. And if you go to get counseling or something like that, you're kind of a black mark on your resume, right? Is it still the case?
You know, I like to think it's changing. I really like to think stigma is still very real, though. And stigma is really what kills people faster than the drugs. Because if you're stigmatized and ostracized and you're afraid to talk about it and bring your family and loved ones and friends in on what's happening in your journey, then it's really easy to lose hope. So when you talked about there being, you know, is suicide related to addiction? I mean, there's an example where it really is, the connection is there, right? Because stigma 100% kills people faster than the drugs actually do.
I think these initiatives like Bell Let's Talk has certainly helped with that, making people realize. I mean, Mary said it. I mean, more often than not, trauma is what these people have experienced, and Bell Let's Talk really brings home the fact that it's not. You don't have to be homeless. You can be a professional and have these kinds of issues, and I think it is getting better where people are realizing now that it's better to speak out. I just saw an interview with Corey Perry, who's back in the NHL with the Edmonton Oilers, and he got turfed from an incident that happened back in November. The Chicago Blackhawks terminated his contract. He walked away from $4 million. But he spoke yesterday about his mental health issues and that about the stigma of it and how he was so happy that he was able to, deal with it and actually bring it to the forefront. The stigma, a lot of people see these individuals that are committing crimes. They've got mental health addiction issue. They're committing crimes in the city, and everyone gets painted with the same brush. They're a minority, really. So I think it is getting better. Sometimes it's 2 steps forward, 1 step back. But I think the stigma is with programs like Bell Let's Talk is helping with that.
I noticed a lot of people with the harshest judgment and that reinforce that stigma are full-fledged alcoholics. They don't do drugs, they don't do anything, and they're usually head cases that drink alone, right? Like and they end up a lot of times in because of that personality type and whatnot in positions where they make decisions. So it'd be interesting to see if we get to a social situation where the alcoholism is treated what it should be treated with as far as that addiction and the impact. Even when you're high functioning alcoholic, right? Like I was there a couple times in my life where you can get through the day and you can do your work, but booze dependent, right? So that's why I drink light beer now and that kind of thing. But it's an interesting sort of evolution of perspective. And I really like what you were saying about if we can be a little bit more open to people, regardless of their situations, and just deal with that. But naturally, we like to sort of categorize things and sort of push it over there. But when you look at this homelessness and addictions, even when they do release the statistics, it shows that there's identifiable sectors that can be helped that just need that sort of help through their crisis, their trauma, and wraparound services. What are our homeless numbers now? Do you know? In North Bay area?
They should be being released.
Because they usually do a count, right?
Yeah, and I don't think I have those.
It was pretty high there for a little while.
It is.
Well, I would hazard a guess to say it's still high. And
well, if the warming center is any indication, that there is some times where there's several dozen people and a little overwhelming. And didn't they have to just close it because the staff were sick? And it was like minus 25 out, but there wasn't enough staff.
And that sends everybody into a panic because for that very reason, it's cold outside now. And they had to close it
cold
because all the staff got sick. And what do you do with these people? I read an article a couple of weeks ago from a local article that said there was a number of people sleeping in the parking garage. Again, that's overflow. I mean, there is a process in place for all these individuals if they want to come in off the street, but sometimes those systems break down, and it's.
I can't understand it, and it's hard for anybody else to understand it too. I bet that why would someone choose to sleep outside minus 20 when there is a place for them to go? But then you realize, and if you talk to people, it's, well, I have to give up all my stuff. What I got is what I accumulated.
It's all that I have.
It's all I have.
I can't bring my dog. I have to get rid of my dog to go there. So I did find the numbers. So from a regional perspective, homelessness, addiction, and mental health issues are at a crisis level in Northern Ontario. The data revealed northern municipalities had higher homeless populations on a per capita basis than Ontario's largest municipalities. In this district, the 2021 point in time count showed that 64% self-identified as having mental health issues, 70% identified as having issues around substance use. So the actual number is not there, but it's definitely connected to.
And again, I hear stats like that, and it's so frustrating because there's a lot of good organizations and a lot of good people doing a lot of great work here in the city, like CMHA, like the hospital, like the crisis center. Again, city council and the city, they're now stepping up with, implementing the community safety and well-being plan. And so I've been in their position, and it's frustrating because you feel you're making progress, and then all of a sudden you start hearing stats like this, and it's like, what the heck, man? It's
well, if you really add it up, though, there's been quite a bit of progress in the areas of support and accommodation, like the Northern Pines, like you just explained. When I last remember seeing the statistics, there was something like about 40% of the homelessness was Indigenous people that were coming from outside the area that were here, urban. And the Indigenous Friendship Center across the street, what is that called? Did they do?
Suswin?
Pardon me?
Suswin?
Yes, yes. So that project in the last couple of years provides a little bit of accommodation relief, and I think there's another really good amount of progress in that area over by the old McDougall School, right? And they're looking at having accommodations in an apartment building there too, not really connected just with Indigenous, but for low income. What is that again?
So the old, is it Dr. Carruthers School there? I think that is an...
Oh, did I say Carruthers or McDougall?
It's one of those. But
Ben, do you mind looking up the address for McDougall School in North Bay? I think it's over there.
So that property was...
1040 Brook Street.
Yeah, that's it.
Yeah, okay.
Okay.
So McDougall.
So, yes. So it's an Indigenous center now, and certainly that's that was started by DSAB.
Right.
And there, but the services that are being provided in there now are being provided on a daily basis, and they are, my understanding, they are definitely assisting with the issue and with the program. I think what you're thinking of about the housing was we severed a chunk of that land to create social housing. So there's an approval there for up to 60 units that DSAB, when they're ready to pull the trigger, they can build these units. It'll be in conjunction with the Indigenous groups that are in that line of work.
I just had another thought. Does the CMHA work with the justice system at all, with the overcrowded North Bay jail and the court system that's kicking people through and not being able... Can you explain a little bit about the justice system thing with mental health and addictions?
So we do. We have a court justice program, and we have a forensics home as well. So what that program does is it helps people when they're coming out of the system to find housing and to reintegrate back into the community in as best way possible. And that's another thing around stigma, right? Once people are criminalized, it's harder for them to get jobs. It's harder for them to stay away from their old friends and their old behaviors. So we do have the justice program. We have... So we don't have any other housing specific to that, but we do have an aftercare housing pilot project that began in January 23, which is new. So once people finish in the Oak Street Treatment Center, the 90-day treatment center, that we're calling it 3-quarter-way house till we come up with a better name for it. There are room for 6 people to transition, so they can live there up to 6 months while they transition back into the community. So there, it's a dorm-style accommodation. We also have, what other programs? So in that one, I speak to that one a bit more. It provides up to 6 months. They benefit from structured, supportive living environment. They receive assistance with life skills and vocational and education readiness. And participants then provide peer support to others who are undergoing treatment. So we know that if people have purpose and meaning, they're more likely to stay away from their old lifestyle. Right. So you give somebody 6 months of stability. Well,
you need a dream. You need a dream.
I always need a dream. Purpose and meaning. So they go back, they're working with their peers who are new to the program. At the end, they'll have been 9 months in recovery. And then by then they're ready to go back to school and, really integrate. Hopefully have repaired relationships with their families and friends and are really able to reintegrate.
That leads into the next question about addictions treatment availability here in the city. So say I was addicted to opiates and then needing help. but I want to keep my job, and I got to keep my house, or I can't leave anything behind to go into, I can't leave for 3 months. I can't, right? Or else it's going to be worse. I think that holds a lot of people back. What does somebody is like what kind of treatment can you get that isn't residential?
Yeah, so there's a whole continuum of treatment available.
Okay.
So for somebody who's on opioids or addicted to opioids, there's brutal withdrawal from that. So
Yep.
you'd want to get them into one of the clinics in town, or you can even now go see your doc. Your doc can prescribe Suboxone or methadone. All docs can prescribe Suboxone. You have to have a special license for methadone. You can take that at home. It just keeps you from getting sick. You don't get high. You taper down over a period of time. While you're doing that, you could see somebody at community counseling center, for example, for outpatient treatment, where you're going in once a week, once every couple of weeks to do counseling, deal with the underlying reasons that you were using. The other option would be to go to the hospital. Their program there is day and evening treatment. So again, if you need to do your groups in the evening, so it doesn't, if you're working in the daytime, if you're working in the evening, you could go to their day groups. So lots of flexibility there, more than we've had in the past. And that resulted from the RUSH report, I'm sure you've heard about at some point, that did an environmental scan and made recommendations for what was needed in our region for treatment beds. And what they clearly stated was we have enough residential beds in our community. We need to actually cut back on those. And so the hospital pivoted and created the day-evening program out of that.
Well, how does that Lakeshore Treatment Center fit in that picture?
Yeah. I not really in a position to speak to that. I
Okay.
wasn't involved in the planning. I've heard most recently they're looking at opening in the spring. Is the most recent date that was given by Minister Fideli on the weekend. Yeah, I don't.
Well, maybe I'll
lot
have to
of
get
information.
somebody from that organization in for a podcast interview, because I'd like to catch up with what's really going on with that. I've always had a little bit of a question mark about it, but that aside, I know that there's professionals in town who are cocaine addicts. Basically, they're running their lives at high steam.
Yeah.
But they would never seek treatment because of the stigma and the possibility of it not being anonymous, right? Some actually go out of town for treatment and
Yeah.
try to find it that way.
Yeah. And the great thing about where we are now is, as a society, is that you can have a therapist anywhere pretty much in the world and do online therapy, right?
Yeah.
Video therapy. So you could see a counselor that way. They wouldn't know your community. They wouldn't know about you in the context of your community. You could also because residential, like you said, isn't reasonable for everybody. So if they're high flying professional people, they're probably going to want to do the individual work with somebody out of town.
Yeah, no, for sure. That's interesting. The online ability for therapy. Does that actually work? Like, I don't know if
It does, and I'll tell you, I was a skeptic.
Yeah.
Because having been a therapist for many years and supervised a clinical manager for psychotherapists, when COVID happened, and we always did a little bit of it, right, for specific reasons. But when COVID happens, our whole organization, Community Counseling Center, pivoted, everywhere in the world pivoted to online. And it worked out much better than I would have thought. The basic skills are the same, right? Good listening, good body language, good appropriate eye contact, reflecting, all of those pieces. But then there are some tricks that you can learn while you're doing it, like how to move into the camera, how to ensure the person is engaged.
Oh, okay.
So it does work with
It's
the skilled
probably a
therapist.
skilled set in itself to be able to speak
Absolutely.
online with somebody. All right. Okay.
For sure.
Interesting. I think we're going to wrap it up in a little bit. We got a couple more minutes. Is there another message coming from the CMHC that you want? And then, Dave, I'm going to ask you after that to give me your last thoughts.
Yeah, so I would say that the message from CMHA, North Bay and District, is that kindness goes a long way. Mental health and addictions issues can impact anybody. There's nothing that anybody in your family can be impacted by it. The shame and stigma, like we talked about, that has to change. We're here for you. We want to support you. We have a treatment center that you're welcome to come into. We also can set you up with other services. And we really want to work together with our community partners and our community members to provide the best service possible in the right time. Some of the pathways we've created with the hospital, people can go into detox directly into treatment, have been a huge success, and I'm really proud of that. I know Mary Davis is too, and Andrea Lucas from the hospital. And our partners at Community Counseling Center are great. They're really good therapists there. So everything you need for your wellness is right here in your community. Yeah.
And Dave?
Well, just to follow that up, I mean, again, we talked about Northern Pines, 61 beds that, and I think everyone is committed to see that fully operational and fully utilized. As I said, there's individuals in there as we speak right now getting assistance. I really hope that the city is able to put together that purchase of that building beside the gathering place. They will need to partner with the professionals in the city to make sure that unit is staffed, where it becomes a warming center, a drop-in center, and the goal should be to get those individuals from there into making a decision to go into Northern Pines. The criminal element of mental health and addictions, I would love to see a day where, the police are so frustrated. I mean, they arrest someone because they've committed a crime. They take them to the hospital, and once they're of clear mind, they're released. And if they're charged, they're out in the street the next day. I would love to see a time when that individual's put in front of a judge, and the judge gives that individual two options. You can either go get help, or you can go to jail, or take it one step further. And if they become a nuisance to society, a danger to themselves and to the community, they should, against their will, be taken to a facility. And I think if we were able to see our way, and obviously laws have to change for that to happen, but I think that would be a big step in the right direction.
Interesting. I certainly lean that way. I would like to see a modern jail system with wraparound support and addictions treatment there, and not they have a choice. But there's no choice now because the judge doesn't have a jail to send them to. Usually they're overpacked, and there's a lot of issues regarding that. But I remember with Rod Biltz was talking about some legislative changes that were coming into play to change how the mental addictions could fall under the same rules for mental health, for forced treatment. A lot of people debating on the morality of that.
Mm-hmm. The ethics around that.
The ethics, eh?
Yeah.
And when you were talking about people being kinder and more accepting, I think also the more very important thing is, I think in our younger elementary schools, we should actually be teaching more about how self-care and resilience and to stand up for yourself and to accept your issues and move forward, and not expect other people to be kind when they're not, because I don't think we're going to find anytime soon a world where it's consistently kind when you go through it. So resilience and the ability to have self-care, I think teaching yoga and meditation to grade 2, 3, 4 and that kind of thing. Because I see full-grown adults go through their lives traumatized and injured, and not until they're 50 or 60 do they discover how to take care of themselves, right? Wouldn't that be great if we were doing it when we were 30 or 40?
Oh, prevention.
Yeah.
Prevention is the key to all of this.
Right on.
Right? I mean, it certainly wouldn't, There will always be addiction. There'll always be people who need to escape for whatever reason. But good prevention programs does build resilience. It does build people's ability to cope and connect and move forward without having to hide behind substances to the point that they're destroying their lives.
Start treating mental health and addictions like an illness,
Yes.
like a sickness,
Yes.
just like any other medical issue that you would have. And all the help and services are there for you. That would be another, step in the right direction.
If you look at Portugal, many years ago, they had to change their whole system because they were losing so many people, so many lives with overdose. The drug rates were off the charts, criminalization off the charts. They put in whole systems in place where people were able to go and be retrained, and they didn't, if somebody relapsed or if somebody went back to using, they didn't shun them, and they didn't, sorry, Dave, but lock them up. They didn't do that because right now I hear what you're saying. There's nothing else to do. Like, people are at a point, they're like, what are we going to do? But if we look at systems like that, countries like that have figured it out, there are lots of good models that we could follow.
Oh.
Drug policy is the huge, biggest one.
Well, that's a good way to end our conversation. Thank you very much for coming.
Yeah, thanks.
It's nice to get to know you, and thanks, Dave, for coming again.
My pleasure, as always.
Well, it's I'm not really a huge Bell Let's Talk person just because of the corporate nature of it, and Bell, they always bother me. But I am a customer, and you are using my money for your own marketing. And so whatever gets people talking is okay. As long as people are talking and able to communicate a little bit every day, I think we're going to head in a better direction. So thank you very much, and see you next time at Small Town Times. And check out North Bay Echo, where we have a newsletter twice a week, Tuesdays and Thursdays. I put it together, and appreciate the subscribers, and listen to all our podcasts, and plug, and have a good day.